Good afternoon and welcome to another edition of your favorite health program, You're in Health, aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Today, we'll be exploring the growing concern of gonorrhea, a sexually transmitted infection that affects millions worldwide. Our discussion will cover the risks, symptoms, and treatment options available, as well as prevention strategies to better prevent ourselves and also our loved ones from contracting the disease. But before introducing our guest for the day, let's welcome my co-host, Ese Lucilengo. Good day, Lacey. It's a pleasure having you on the program.
Thank you, Immaculate. It's a pleasure as always, and good afternoon to all our viewers and listeners out there.
Our guest today is a general practitioner and she's known as Dr. Glory BEFEKE ANYE. Good day, Doctor. It's a pleasure having you on the program today.
Thank you, Immaculate. Good day.
As you heard in the introduction, gonorrhea is a sexually transmitted infection that is affecting millions worldwide. But before getting to that, we want to know, what is this disease all about?
Gonorrhea, as you've rightly stated, is a sexually transmitted infection caused by a bacterium that is known as Neisseria gonorrhea. And oftentimes is transmitted from infected individuals vaginally, orally, rectally, to an individual who apparently may be healthy. And sometimes we equally have some transmissions from mother to child, from infected mothers to babies during delivery.
Now, talking about men and women, are the symptoms the same?
The symptoms vary, but there may be some similarities. For the men, it's usually characterized by painful sensation when urinating. Sometimes we may have a pus-like, can be yellowish, can be whitish or greenish discharges that come from the penis. Equally, we may have for the men a pain, what we call epididymitis, an inflammation at the level of the tubes near the testicles, and it may cause pain and swelling. So sometimes we may have swollen testicles, although that may not be really regular, but sometimes we may have cases like that. For the women, we may have this painful sensation upon urination. We may equally have increased discharges, vaginal discharges. You find a woman who all the time complains of discharges, vaginal discharges, and sometimes we may equally experience bleeding within periods. See, some women within their normal menstrual periods, they will complain that they have had menstruation in between. Sometimes equally you may have some of these women experiencing pelvic pain or abdominal pain. Come to hospital with chronic pelvic or abdominal pain.
Talking about the discharges, how can you tell your discharge is different? Because you said there the discharge is kind of is like often compared to before.
Yes. So gonorrhea for the men is very easy to detect. For the women, sometimes it may take some weeks or some months, or sometimes they may not even have symptoms. For the discharges, it's peculiar. You have a kind of purse-like, it's like pursy, and this purse we usually want to see that is brownish or yellowish, but sometimes it comes out, especially for the men, a little bit whitish in abundance, yellowish, greenish. Then for the women, we will have these discharges quite in abundance. It's different from the ovulation discharge. You know, for the women, we know the discharge that comes with ovulation, where it's jelly-like, sticky. That's not the kind of discharge. Here we are talking of an abundant discharge that comes out of the period of ovulation, and sometimes it's very, very regular.
And now, before we get to the mode of transmission, we would like to give out the numbers to those listening and viewing on your screens. For the viewers, for the listeners, we have 670-547049, 670-547049, or 656-62-2222, 656-62-2222 at the end. And back to you, Doctor. I'd like to know, how is the disease transmitted?
The disease gonorrhea is transmitted from unprotected, that's the basic way of transmission, unprotected vaginal, could be anal, it could be oral sex. It could also be from an infected individual to one who is not infected. It could also be transmitted by the sharing of sex toys for those who have such practices where they use toys as sex objects. So when these toys are not properly cleaned and they share among themselves, gonorrhea can be easily transmitted. Also, during delivery, we have some infected mothers with gonorrhea during delivery, especially vaginally. The transmission can go from the infected mother to the born baby during that process of delivery.
How then can gonorrhea affect the reproductive health of both men and women?
For the women, gonorrhea may cause what we call pelvic inflammatory disease when it gets too chronic. Because for the women, they will hardly start experiencing symptoms. Is better with the men. The symptoms come quite early, but for the women, it may take some time. So when it gets chronic, you have women coming to complain of pelvic pain or abdominal pain. When we do an ecography or when we do maybe a vaginal exam, we realize that the one is suffering from what we call pelvic inflammatory disease, PID. It can also cause ectopic pregnancies because of the infection. You see some women, not all ectopic pregnancies, however, are caused by gonorrhea, but sometimes we may have this infection that gets chronic and it gets into the tubes and prevents the baby from descending because of the inflammation. So it will keep the baby along the tubes. And you see when the zygote is fertilized, instead of descending into the uterus for better growth, it gets attached at the level of the tubes. There the baby can't grow, and that's ectopic. That means out of the normal environment, out of the uterus, baby starts developing where it's not supposed to develop, ectopic pregnancy. And sometimes it may even lead to infertility for the women. For the men, it will cause equally, may cause infertility. It may cause this pain, as we had highlighted, epididymitis, where it is an inflammation of there's a tube near the testis, and so the men will start experiencing a lot of pain at that region, and infertility.
How can gonorrhea be treated?
Yes, gonorrhea is treatable, it's curable. There are antibiotics. Sometimes just a dose of an injection of an antibiotic can be treated. Meanwhile, we equally have some resistance because of multiple usage of drugs these days. Gonorrhea tends to resist the normal treatment. But in the hospital, when that happens, we can do culture and others to get the specific antibiotics for that particular germ, for the specific germ. So it's curable.
Okay, talking about, I know of someone who is currently married, and she told me she had gonorrhea. She went the first time she did her test, and she noticed that she was positive. She took treatment, she took antibiotics, and after that, taking the antibiotics, she went to another hospital where she did the test, and it showed that she was negative. Next time, but she still continued seeing the purse-like discharge from her private, and she had to go to another hospital, and they said there is still negative. So still saying this, she was still worried. So she went back to the former hospital again where she took the first test and it was pronounced positive, and noticed that it was positive. She was confused and asking herself what must have happened, and they even told her that the level has even increased, is not at the same first level it was before, and due to that she has been unable to conceive for a while now. And she says even her, like during ovulation, what usually comes out doesn't come out, and she thinks that maybe it may be as a result of this infection, and that's why she's unable to conceive. Can you explain to us what could really be happening? Here it's negative, here it's positive. What's happening?
All right. Given that gonorrhea is a sexually transmitted infection, it's not by one person. It can equally be among the homosexuals, but we have it among these heterosexuals. Now, once we diagnose someone of gonorrhea, we always want to treat the partner or the partners Otherwise, we'll have reinfection, and it may happen like in this case where you're highlighting. Probably, I don't know this case. We are not accusing. Probably, this individual, this lady took this treatment alone. I don't know. But probably, the medication was administered to her alone. And she took, probably when she went for the exam, the control exam, at that moment, probably it might have read negative. Then she went back to her partner who might have not been treated. I don't know this particular case, but this is a hypothesis which it happens. Yes, it happens in this way. So if the partner was not treated, it's very possible for her to be reinfected, and you see this gonorrhea recurring. So once partners get diagnosed of gonorrhea, it's important to share their diagnosis with their sexual partners so that they both can get treated. In the meantime, while they are under the treatment, sexual activity needs to be avoided, or maybe they can use the condom to protect. But we always advise there should be abstinence, so that after the treatment, a control test should be carried out, and both partners should be declared negative before they continue with sexual life.
And how long does the treatment last?
Yes, treatment can go on for 2 weeks to 1 month, depending on maybe the severity and the resistance within which the individual had. You know, these times there are people who, when they just start feeling some itches or unwell, they go to the roadsides and get maybe any antibiotic. Just go and tell the chemist, and maybe the pharmacist there may give them an antibiotic. That gradually it creates resistance to this bacteria. One never knows, and when that happens, it gets difficult to treat when one is actually diagnosed.
All right, so you're talking about untreated cases. Are there some other pathologies that are linked to treated cases of gonorrhea?
Yeah. Once gonorrhea is not properly treated and it creates that resistance to antibiotics, it may not join a kind of bigger family of antibiotic resistance to bacteria, to a bigger group. There are various types of bacteria. Here we're having Neisseria gonorrhea. There are others. So it may enter that bigger family, and it makes it very difficult for treatment to be effective. Maybe syphilis, maybe chlamydia.
We have a caller on the line, Ima.
Hello. We just lost that caller. Try calling the numbers to participate on today's edition of the program to ask your questions as far as the topic gonorrhea is concerned. The numbers are 670-547049. I repeat, 670-547049. We have a call on the line. Hello.
Hello, good day, ma.
Good day, sir. Your name, where you're calling from, and your question.
Yes, about treatment of gonorrhea, I want to ask the practitioner there.
Yeah.
That between conventional method and traditional method, which one is best to treat gonorrhea effectively? Some people say it's traditional, some say it's conventional. So, what's your advice?
Okay. You got the question?
Yeah, got the question. So our brother wants to tell you to go for conventional medicine. From experience, I wish to tell you that most of those tradi practitioners, they come to the hospital. I receive many of them. They come to the hospital for treatment of gonorrhea, syphilis, chlamydia, but they sing at the roadside that they can treat gonorrhea, chlamydia, syphilis. So it's conventional medicine. Otherwise, you may end up destroying some other vital, visceral organs within your system. So go in for conventional medicine, where a clear diagnosis will be posed, and in case of resistance to the bacteria, a culture test can be carried out. I don't know if all of that traditionally can be done, but it's always advisable you do your conventional medicine, where we have the experimental proofs.
But now that we have several cases of antibiotics resistance, people have been opting for this this other type of drugs, traditional medicine. Don't you think there could be some sort of truth in that?
Yeah, that's why the culture comes in play.
Okay.
So once we realize there's a resistance, we do the culture, and once we do the culture and antibiogram, it gives us the exact the specific antibiotics for that specific bacteria.
Okay.
And at what level should we be worried when we are experiencing some of these symptoms?
Yeah, recurrence, when you keep having those persistent discharges, like the example Immaculate was highlighting earlier on, when you go to hospital, you've been diagnosed and given treatment, the control test is done, and you think that is negative. After you have discharges or some symptoms, abdominal pain or pelvic pain all over, you have to start getting worried. You have to start checking around what is not going right. Are you reinfecting yourself? So, and also when you're not getting pregnant, sometimes some people get married and there's a lot of expectation. Oh, after 6 months, 1 year,
Exactly.
2 years, 3 years, 4 years. So you should also start getting worried and go in for screening, proper screening.
You are a medical practitioner. How often do you receive cases of gonorrhea? Is it very common in Cameroon?
It's very common on a daily basis to receive cases.
Like approximately in a day out of 10, how many patients can you receive suffering from this condition?
Okay, out of 10, we can receive 2, 3.
Okay.
2, 3. And it's mostly common in men or in women in our context.
Well, if it's common in one,
it should be common the other two.
Common
Exactly. Because
so when the woman comes, automatically we know the partner is infected, because it's not something isolated. It's the both. So the fact that the men may not come to hospital, or the woman may not come because probably she has not started having the painful sensation during urination, because the man will always come.
We have a call on the line. Hello, good afternoon.
Hello, thank you.
Your name, can you turn off your receiver, please? If it's your radio or TV set, turn it off.
Okay, thank you so very much.
Okay, yeah. Your name?
I'm calling from Bonaberi.
Okay.
I just eventually saw on your program that is going on live. I'm a health practitioner.
Okay.
That is a herbal practitioner.
Okay, sir.
So I'm just listing one of the programs from our able colleagues. You know, sometimes when we want to give information to the public, we must be very, very conscious. As a health practitioner, what the question came directly as I tuned out about on my television, and I heard that question from an innocent somebody who is not even in health, who needs a guide. And then from what our mommy or our sister responded, that she receives cases of herbal practitioners who come more often in the hospital, indicating that conventional medicine could be more
effective,
sustainable, or possible cure to general infections as such. But I want to talk on this point, because when we talk of traditional practitioners, we should not give it a generalized name, because there are people who are in this sector not as key actors of this industry. There are people who are in this sector as Facebook knowledge people. People who go to Facebook, they say things will likely pick this and pick that, and become doctors. You can receive them in the hospital because they don't have any possible solutions to cure their infectious problems. We, as key actors of the herbal industry, both physical and spiritual, made naturally, there is all possibilities that I can tell Africans or Cameroonians as a key actor in this herbal practitioner. Even with people in the studio now, because we are all African, we cannot hide the truth. Our enzymes that help to digest the medicines that we take, that goes to the various areas that is supposed to be healed against these bacteria. It is produced naturally from things we eat. We cannot be eating the pakoko, eating the bangasu, eating the vegetables produced in Africa, and then we expect medicines from a strange land. I'm not against conventional service, because I know conventional service has played a big role in the health sector as far as general health, the general health system is concerned.
Thank you so much, sir. Thank you so much. Due to time, we will not be able to continue with the call. Any last word? Would you like to add something to what he was saying there before we end the program?
Okay. Anyone who starts experiencing any of these signs or symptoms, please find yourself to any health unit. Get tested by a medical doctor. Get diagnosed and follow your treatment in the hospital.
Thank you so much, Dr. Gloria BEFEKE ANYE. And Lucy, thank you too for taking part in today's edition.
Always a pleasure, Immaculate.
And that's where we put a cap to today's edition of the program. You're held on Equinoxe Radio Multimedia. Thank you so much for watching and listening. It's always a pleasure being with you. Have a wonderful day in the company of more interesting programs on Equinoxe Radio and, of course, television. Bye-bye for now.